Senator Sinema.
Thank you, Chairman Tester, for holding this hearing, and thank you to our witnesses for being here today. With over 500,000 veterans calling Arizona home, conversations around accessibility of veteran-specific health care are critical to ensuring the welfare of our state. Access to veteran health care services in rural areas is often limited, and it's necessary to come up with ways to keep our veterans from going without services simply because they can't reach the facilities that are able to provide them with care. In circumstances where non-VA emergency medical care results in saving these veterans' lives, they shouldn't have to jump through hoops to get reimbursed. And that's why I, with Senator Braun, introduced the Relieve Act to expand the eligibility for veterans to access emergency care from a provider outside the VA. I've also joined with Senator Moran, our ranking member, in introducing the Health Act to ensure Arizona veterans retain the ability to make their own decisions around their health care, while also making much-needed improvements to the quality of care provided. And I look forward to working with both Senator Moran and Chairman Tester to continue to improve options for community care. My first question is for you, Ms. Thomas. Nearly every day, my staff helps Arizona veterans navigate an unexpected VA medical bill. What efforts should the VA implement to ensure that staff and community emergency departments are aware of the new eligibility criteria to prevent the veteran from experiencing issues or reimbursement delays? And do you believe legislation like the Relieve Act will help address the problem?
I do believe, thank you for the question. I do believe that the legislation, the Relieve Act legislation will definitely impact those veterans, definitely understanding that when a veteran needs to be able to receive emergency care, they need to receive emergency care. It shouldn't be, they should not be burdened by the fact that they didn't get their initial visit at the VA to get that care.
Thank you. Mr. Retzer, Arizona has many veterans living in geographically isolated areas like Show Low or Pine Top, where it can be harder to access care due to the lack of community providers or outreach or communication. Have your organizations raised similar concerns with the VA to ensure that these veterans are informed of their eligibility and have access to the care that they've earned?
Senator, thank you for that question. That is actually a question that is asked to our national service officers out in the field. That's one of the things that I spent 14 years advocating out there and spent 20 years with the DEV trying to navigate this issue and trying to influence VA to ensure that they're doing proper training of their patient advocates, their staff, and to ensure that they're sharing that education and knowledge to the veterans on what they're eligible for. So when we look at VA's infrastructure, it is very difficult for them. So we continue to speak with the VA and collaborate with them to where their shortcomings are, where there's more improvements to improve the veterans' experience in both the benefit side and the health side.
And as a follow-up, what steps could the organizations here today or our congressional offices take to ensure that veterans in Native American communities, for us particularly the Navajo Nation, receive either the same or better outreach?
Thank you for that question, too. And I think one of the things that we're seeing in the legislation here is very thoughtful in the way that we're looking at for our rural veterans or veterans in remote areas. And it comes with collaborating with the VA to do outreach. For example, the direct health care system of having direct connect to our homeless veterans, for example, could be the same application to our Native Americans who are needing those assistance, who have those barriers, and who may also have some issues or cultural issues with, working with the VA system. So we need to be able to ensure that we open the doors and start to communicate and show the communities what they are entitled to and make a warm entrance into it by making sure we have partners on both sides that are being trained equally the same way and that understand the system.
Thank you. Mr. Lorraine, my office also hears from Arizona's veterans about the cumbersome community care referral process, which can negatively impact continuity of care. One issue my Health Act bill is trying to address is to ensure that veterans who are seeking mental health care or treatments for substance abuse can self-refer to get the help they need when they need it. What improvements to the referral process should be made to make it work better, and of course, without delay for patients and caregivers?
Yeah, I think, especially those two areas that you just talked about, they're stigma-ridden. And I think if the veteran can have the ability to directly seek out care for whether it's mental health or substance abuse, that's important. America's Warrior Partnership, one of our programs is the Dine Nazba Partnership. It's Navajo women veterans that are employed by us that work up in Show Low, they're up in Chimney Rock, or Window Rock, and Shiprock. Yeah. We see it all the time. We see it, hear from them. Their goal is to go find and develop a relationship with veterans. Their biggest issue is that there's facilities that are local that they could use, but there is no way, there is no mechanism to go use those. They have to either go to Gallup, as you know, or go down to Phoenix, which is a pretty arduous trip. So we have, between the Alaska Warrior Partnership and our work in the Navajo Nation, we have extensive experience. I would just also, and I know I'm running over, I would also say that the thought that we're going to call these veterans when they don't have, they barely have electricity, they barely have water, and a phone is something that's far beyond that. I think that it's a personal relationship, especially within the culture of the Navajo.
Yeah. Thank you. Thank you all for taking the time to be here today, and my team is going to continue working with all of you. Mr. Chairman, thank you for the hearing.
You bet. Thank you. Senator Murray brought up expanding Veterans Option for Long-Term Care Act, a bill that I've got, and she talked about the